Reagan Robertson here with Productive Dentist Academy. Get ready to join your favorite podcast hosts, Dr. Bruce B. Baird, Victoria Peterson, Dr. Chad Johnson, and myself, Reagan Robertson, at the nation's #1 dental business course that guarantees practice growth. That's right. Full immersion CE, so you can consistently produce more and align your team for results without compromising excellent patient care. Productive Dentist Academy has a special running this month that you can activate immediately. It's called the PDA Productivity Bundle. And we put this together so that you could attend this workshop, which is happening September 22nd to the 24th in Frisco, Texas at the Hyatt Regency, along with tools to make sure that not only are you getting great education on how to increase your productivity, how to communicate better with your team and your patients, increase your case acceptance, authentic market practice, and more, you also get a 2-hour business advisory session before the workshop to really get clear on what matters to you most so that you can be set up for success at the workshop. And following the workshop, you get 12 months access to PDA On Demand. That is the entire productivity workshop on demand for you to make sure that you are doing everything you can in your power to soak up all of that CE and implement it come Monday morning, the next month, and the next month, and the next month for 12 months down the line. Registration is now open. The tuition cost is $2,195, which is ridiculous because it's regularly $5,528 for the productivity workshop attendance, 2-hour business advisory session, and 12 months access to PDA On Demand. Hop on over right now to www.productivedentist.com/workshop to grab your registration today. Again, that is www.productivedentist.com/workshop. If you cannot wait and you have to have it right now, email Brent, B-R-E-N-T, at productivedentist.com. That's Brent, B-R-E-N-T, at productivedentist.com, and we will save you a seat. I look forward to seeing you there. Welcome to the Everyday Practices Podcast. I'm Reagan Robertson, and my co-host, Dr. Chad Johnson, and I are on a mission to share the stories of everyday dentists who generate extraordinary results using practical, proven methods you can take right into your own dental practice. If you're ready to elevate patient care and produce results that are anything but ordinary, buckle up and listen in.
I think I'll paint the picture here for listeners. We invited Dr. Shawn Knorr on our podcast today because Chad and I really want you to be able to see into the mindset of what we consider to be a very high-producing, professional, successful doctor who still feels like there's a long ways to go. And so I think understanding your story, Shawn, is really important for us and for listeners, to help us paint the picture of where you're at today and then where you want to go 5-10 years from now.
Yeah.
And before you do that, let me ask, is the K silent? Are you Knorr or Knorr?
It is silent, but it's easier to say Knorr. So I wish it was Knorr because people don't ever understand what my name is. So yeah.
Dr. Knorr.
Yep. There you go.
There we go.
Okay. Just making sure.
It's all good.
We wanted to know.
Yeah.
Oh,
exactly. That's pretty good. Yes. Well, I guess just like starting off, like I did a residency at Hennepin County Medical Center, which I guess I highly recommend for any doctor out there to do a residency of if they have the opportunity. So there's a high oral surgery component to it, and it was a level 1 trauma center. So I got a lot of exposure to some pretty intense situations and then also really neat surgeries. So I think the confidence level from that really grew. And I think CE can do that same thing for you. But I would say I've kind of started off on that pathway and joined a small practice, out of the residency. And it's in the neighboring town. And I just remember the first time I talked to the doctor, he's like, "What is a Hutchinson boy doing in Glyco, And I was like, I don't know. My wife told me to get a job. So that's kind of how it started off. And I would say that the early part of my career, like I was not productive at all, like it was, but when I look back, like I could compare myself to some of my friends and stuff like that. And I would say like it was a little bit of a struggle. Like so I bought the practice like maybe a year and a half into being there. And then the dentist slowly retired. And then when I bought it, I would just say that the numbers were tough. I was just like, the loan was kind of hanging over my head, and I don't know. It wasn't always sunshine and rainbows, I guess.
Oh,
And,
yeah.
like I would say that the practice was a very insurance driven practice. Like we were only a provider for one plan, but like we're in a small town, and like people with insurance would come to our office because they didn't really have anywhere else to go, And so I was doing insurance based dentistry, and like I like just it was kind of a struggle. And so like my idea at the time, being inexperienced, was like, well, let's speed up the treadmill, and
All right.
it was like, let's do more and more. And my staff, like they're all a little bit more mature than me, and they're like, you're gonna lose patience because you're going too fast, you're not creating relationships and connections. And I appreciate that I had a great staff that actually felt comfortable being able to say that to me, but I didn't pick it up right away. It was a slow process, and just kept running the treadmill faster and faster. And like I would say that I definitely reached a point of burnout, like yeah.
So we met at the February PDA workshop. Was that kind of where the tipping point was headed? Is that when you found PDA? I mean, how did you end up like, what was the breaking point that made you say, all right, that's it?
Well, I would say that I've been secretly stalking PDA for years. Like I kind of got into Gary Takis's
Oh,
podcast.
yeah.
Like I think he does a great job, puts out a lot of great content for free, which is amazing. And he just was saying he was recommending his doctors to go to the PDA course. And I was like, oh, I better look into this. So I don't remember where and I got some of this stuff, but like I think that a lot of what Dr. Baird said, this resonated with me. And I don't know. I felt like I didn't have the money to invest in consulting. So I just tried to slowly bring it into my practice. And it took a long time to start to bring in some of the elements. So it was a slow process. And, like the one, I don't know, like the one thing that I think changed the trajectory of my career and just my life in general is I had, well, I'm a father of 5 girls, and after after our second girl, we had a baby that she was born with a severe seizure disorder.
Mm.
And it was like one of those things that just basically upends your entire life, because for like the first few days we kind of thought something was wrong with her. And
Yeah.
and like then all of a sudden she started having seizures, and she was like rushed to the Children's Hospital in Minneapolis. And we spent 2.5 weeks finding, like taking every test that we possibly could to see what was going on. And like eventually it was like, we don't have any answers for you. Like she basically can't sustain life. And so that was a kind of a tough thing. And yeah, it's like one of those situations where it's like one of the hardest things in your life, but it taught me and my wife like a ton of things about what's important in life. And there were so many people that just surrounded us with, care and support and love. And it really, really upended just how I viewed the world and what was important to me. And I wish I could say that it was all up from that experience, but it was kind of a rocky path. But it did change how I related to people. And I like through that experience,
it brought more humanity to you, didn't it?
Oh yeah, without a doubt. Like, and so like the silver lining was that life is about relationships and being true, and treating people as you'd want to be treated, like that's essentially what it is. And just going to PDA, hearing Dr. Baird on his podcast and stuff like that, I don't think I ever really appreciated the type of person that he was and what he exactly was talking about. But going to the PDA conference, it is a resounding, your practice is about the relationships that you create from top to bottom, from people that come to see you, your staff, every single component. And I think that until you met Dr. Baird in person, it was hard to really comprehend that, I guess. And then the other thing that I really liked about PDA is just that the group of people, they seemed like high quality people that were genuinely concerned about where my practice was at, and helping people get better oral health, and it wasn't phony in any way. And I worked with another consultant and I didn't necessarily get that, and I walked away from that really truly excited about what PDA had to offer. And it was really nice to see, I guess.
So here's what's cool, Reagan. I mean, honestly, when I first wrote Shawn and I said, hey, would you, it's nice meeting you at the workshop. Would you come on our podcast? He was like, I mean, I will. But he starts out, I would be willing to do a podcast, but it made me nervous even just thinking about it. So maybe you have other people that, might be better to listen to. And yet, when you hear this, Reagan, what better of a person to hear their story? This rings true again and again, how everyone thinks that it's no, it's the bigwigs down the street that should, or, across the nation that should be getting these kinds of interviews and podcasts and stuff like that. And it's no, it's guys like you and me that have great stories that we need to share. So Reagan, how does that resonate with you when you heard that backstory?
Oh, well, everybody has a story, and I say that all the time. Everybody has a reason for why they're where they're at today. And I think that helps. I mean, it helps me understand you better, Shawn. Hearing that about your daughter. How many years ago was that when that turn happened for you?
So it was 2014 when she was born. She lived about 6.5 months. So yeah, February 1st of 2015 is when she passed away, unfortunately. But yeah, so it was a while ago, but it brought a lot of self-reflection with it. That is for sure.
Well, yes. It takes a lot it's difficult to translate that through podcasts and interviews and everything to get down to that level that really resonates on why we do what we do. And I can't say enough about, I think you hit the nail on the head when you said, people genuinely care about the patient health and being advocates for patient care. I know Dr. Matthew Standrich, which is a doctor that I am friends with on Facebook. He's been to PDA before. He shared a story this morning with me, and it was about being really dogged about some signs that pointed towards oral cancer. And they got the first opinion and it came back negative, and he followed his intuition and said, I think you need to go through and you need to get another opinion like that. I could cry right now. That is all relationship driven. That is you caring and you being passionate and you owning it. And the second one came through and they caught it. So they were able to catch and said, nope, it actually is cancer. We need to get you into treatment right now. We need advocates like that everywhere. Right. All over the globe. We need that. And I think it's a big deal. And it's a hard mission. And I think that we can get caught up in the numbers and the growth and all the elements that we have to say, but there's an underlying current to that. And the pattern that you reflect to me that I see in productive dentists that I've had the opportunity to meet is they all have that same underlying current of care. It's not just about how many patients, it's really what kind of impact am I making?
Yeah, without a doubt. Yes. Yeah, it is interesting. Just like reflecting on where I've come from, to where I've been. And I think, like earlier in my career, like it was maybe a lack of confidence and stuff like that. And I would present treatment that I thought people would say yes to. And I wouldn't necessarily be making a full comprehensive diagnosis. And so my care kind of, yeah, this was essentially, it was real safe. But it also, just going through, like, thinking about how do you be true to your patients? Like, I think you need to tell them ethically, like, everything that's going on in their mouth. And by holding back just because you don't want your ego to be bruised a little bit, like, is like, I found myself being in a selfish place. And like, it was my own, like, I was in my own kind of, I guess, like, ignorance of what was going on. But like, it took a life-changing experience for me to be like, I need to treat my patients better. Like it's crazy. And I was scared, like, I wasn't comfortable with what my fees were. I wasn't comfortable presenting big treatment plans. Like, I would do it occasionally, but like, I had a severe guilt complex about it. And I didn't necessarily believe in it. And it was strange. But like, as I, like, do I really care about this person in front of me? And like, do I cherish this relationship? Like, it's weird. Like, when you start caring about people more, you get over that fear of saying, like, I think we should do an onlay on this tooth versus, a big filling, like, it's like small little conversations that I was cheating myself on, like, on a daily basis. And the patient, like, that
Well,
at
Dr.
this,
Bruce calls that, like, he's like, do I remember the patient's name from this morning, like the new patient, do I remember their name and stuff? And that's convicting, because it's just like, we see so many people that regular people, let's call them regular people,
yeah,
don't understand, like, the volume of human interactions that we have in a day, that are not just a superficial cashier, because a cashier probably sees more people than we do.
yeah.
But to actually, like, be like, so tell me about your genital herpes. I mean, we're getting into deep
Yes,
stuff on
it
people's
is.
health history. And I mean, so
Yeah,
it's not just like a cursory, like, here's your receipt, here's your Diet Pepsi.
Mhm.
yeah.
It's deep stuff.
Oh, totally.
How
Yeah,
did you take, like, baby steps to making that leap from I'm not really comfortable with that, because it becomes a value question.
yeah.
I've done that myself for years. Like, you don't want to charge that because you can't. You just want to do it for free. I'll just do this for you, or do
Oh,
this.
yeah, totally.
And then also that fear of, I don't want to really tell you everything that's going on in your mouth. Like, Chad and I just recorded a private podcast that it's just me
Yeah,
and him, and that was one of the tips that we had is, can we be brave enough to just say, this is everything that I see?
yeah,
So how did you take that leap? I'm sure it was small incremental changes over time.
yeah. Well, I think some of it, well, like I've already said it, I think it's this wanting to be true to people and relationships was the genesis of it. But then I would say I just basically started reading books on, dentistry, and listening to podcasts, and, different things like that, yeah, I guess as people that have walked the path, just becoming more familiar with it. And I kind of am just a junkie when it comes to learning about, business and dental businesses, for that matter. So you pick up things, and like, I don't know, you hear some of the same things over and over again, and it starts to sink in. So I can't necessarily say, like, aha, that was when it
Well,
was. It's been a process of soaking it in for a number of years, I guess.
for the listeners, though, for the listeners' sake, just know that Shawn is an AACD dentist, and I'm part of the AACD too. And that speaks enough to me to know that you're in the organization. I don't really care if someone's accredited or not. Of course, that's always great and cool. But
Yeah.
just the fact that you're even in it tells me a little bit more about you. So when I'll ask you in a second here, but like I just wanted to preface it by saying when I signed up for the AACD, it was at the recommendation of a dentist that was involved with it and the AGD. And I was just like, cosmetic sounds kind of lame. And he's like, honestly, well, I did. I was just like,
you thought that? You said that?
Oh yeah, cosmetics. I mean, cosmetics is not it's a jazzy patient word, but to dentists it can rub them wrong because what we do is not necessarily cosmetic. It should be aesthetic. And so there's this. It's a semantics issue, but it's kind of this drive between like aesthetics and cosmetics. Cosmetics is getting your nail and your hair done, and aesthetics has to do with form, function, everything, like natural anatomy. There's something that says a little bit more about it. So I just said, I have a problem with cosmetic dentistry. It just sounds lame. And he was like, okay, I get where you're coming from, but here's the backstory. And I thought this was interesting. He said the American Academy of Aesthetic Dentistry in the 80s was already taken when he was one of the founders. He was like, when we first started the AACD, so we had to name it something. And this spelled out basically, like near what it was. And I get your point, but then what he said was, my point is you need to go check out the AACD, just check it out. So I went to one and I was like, I think it was 2014 Seattle. And I was like, okay, I shouldn't have been making fun of it because like this is cool stuff. Like these are good high producers. These are good thinkers. They're forward thinking, and they're not just like just mow the tooth down and slap on some pretty teeth. That's not what it's about. It's actually a twofold in a real simplistic regard. Number one, the photography to be able to diagnose and then sell your case and market it and brand yourself different. But then also, how do you do conservative dentistry that is hyper critiqued to bring up your level of anatomical efficiency, proficiency, everything like that. So materials, bonding science, like all that stuff is there. And so Shawn, what's your take on the AACD and what it's meant for you?
Yeah, I would say that I probably had some of the similar feelings as you in regards, and I didn't really know what it was all about, but all I can say is after diving into it, I would highly recommend any dentist doing it. Like just starting to take like photography of your cases in the beginning of a case, like it changes the way you practice dentistry. And then just the level of dentistry that you see at the conference, like it was pretty amazing, like what some of the doctors are doing. And like, I thought it was pretty good, and after like taking pictures of stuff and evaluating your own case and then seeing what some of these other doctors were doing, it's just like, man, I can improve my game a lot,
and to have international speakers, not just Midwest or not just in your state, some good guys, but to actually have like Dr. Coachman from Brazil come up and talk to you, to actually have a class of 30 people where Pascal Magne is teaching composites. I mean, like stuff like that, where it's just like it's amazing to have the huge names.
I have known you, Chad, for years, and the fact that
you've never heard me talk about my secret crush for Pascal Magne.
No, and I'm so happy because I think it is important to have crushes. My big joke with one of my previous mentors, Rick Epting, Rhodes Scholar, incredible man, played the 12-string guitar, was a great songwriter, had bands, and he was really inspired by Yehudi Menuhin, which is a famous violinist. And so the inside joke for years have been, oh my gosh, they are the Yehudi Menuhin of marketing or whatever thing that I'm nerding out on that. So this is my new person. We will know our inside joke will be Pascal.
Yes.
Well, it's funny.
If people can do Pascal Magne style dentistry of aesthetics, you are set for life. I mean, but go ahead, Shawn.
Well, no, like after like watching it or being in his lecture, like I went back to the office and like somebody with a beautiful smile came in, like you do your exam and it's like, oh, everything's good. But I would just sit there on the like front teeth for a while. I'm like, okay, what's that little contour there? And
Yes.
those mamelons and like, where's the, the incisal translucency and all this stuff. And I was like, this is a thing of beauty, and then like,
Yes.
I'd be done with my exam and I'm like, you have beautiful teeth.
Absolutely.
Yeah.
And even in AACD, to go a step further and be like, do you mind if I were to photograph your teeth? I mean,
Well, I thought
if you
that.
ask it that way, would that not be flattering to a patient to be like,
Yeah.
well, I guess you could,
Yeah. I've thought about it.
As
I was like, is this going to be weird?
I didn't know as a patient that this is a real actual thing. You guys actually look at teeth this way. I know I love teeth. Like I'm pretty passionate about teeth, not to that level. I had no idea that this is real, but when I go to see my dentist and he says, your teeth are just beautiful, he really means it, doesn't he? He's
Yes.
not just saying something
I
surface.
think he means it.
No.
Yes.
Yeah.
My goodness. So what is next for you in your journey then, Shawn? What are you've come leaps and bounds, it sounds like, through your whole entire career. You've had things that have shaped you and made your decisions the way that you are. What is next for you?
What is next for me? Well, as far as like practice growth and just where I'm at with my team, like I think the thing that I was so attracted to go to the PDA conference was that I was very familiar with all that Dr. Baird talks about, and I've been trying to incorporate it in my practice even before going to the conference. And I just really this as you become more experienced, I think you realize how crucial and important that your team is. Like my time is extremely limited, and like I'm doing dentistry all day long, and it is extremely rewarding and fun, but also stressful. And I mean, like people need dentistry sort of thing. So like what drives my practice is the team that's supporting me. And which is just crazy, like this last year, our practice from where the pandemic was, and I guess prior, it grew 50% like in 1 year, which is this. And I think it was just like bringing my team along and getting on the same page. And like, I think getting closer to the way Dr. Baird set up his practice. And like, it's crazy how much the team is involved in it and what they're capable of doing to grow our practice. Like, and that's why I wanted to bring all my team members. A couple of them couldn't come, but
yeah, I met them. Where are you getting more pushback, from admin or from like clinical side?
So, well, admin, I guess they can't wrap their head around the way Dr. Baird schedules his day.
Scheduling to production. Yeah.
Yeah. Like Matt, to tell you the truth, I need some help with that too. But I guess but they did an amazing job. We came back and like, okay, we got to leave Dr. Knorr's schedule open for these big, cases and stuff like that. And
there's something to be said though, Shawn. I'll tell you something that, to make sure that listeners get it. The biggest hang up that I had was, wait a second, I can drop an implant in 20 minutes. You want me to block off, for example, if I'm getting paid $2,000 and let's say I'm doing 500 an hour, you want me to block off 4 hours? Technically, the answer is yes.
Yeah.
But then if you have someone call saying, hey, I need this tooth pulled, like I'm in a lot of pain, you can fit them in. Or number two, at that point, then your main objective is to go spend quality time in your exams, building rapport and diagnosis and treatment plans with the patients. And then you can also do little nickel dime stuff. So if there's an occlusal composite that needs done. So in other words, what I'm trying to say is you can break the rule with appointments, but we're talking about actually the ahead of time scheduling. So if someone needs a denture adjustment and you're done with that implant and you blocked off 4 hours, you're done in 20 minutes, let's just say, because you did it guided, it was a super easy tooth. You did it in 20 minutes or 30 minutes. You can put that in at a half an hour or an hour later, to see that patient or to take care of a consult or something like that, because that's more diagnostics. So it's important to know that doesn't mean that nothing else can ever go in that 4-hour block. Your main goal, though, is that you're not so overbooked that you're trashing that implant appointment with 5 surfaces of composite right next to it, and then you're also trying to run and get 5 exams done that hour, and your one hygienist is gone, so you have to clean one 12-year-old's teeth. It's like, it's not supposed to be that way. So in other words, there are rules and ways that you can break those rules, and giving your team the permission to start to understand the nuances of that it's not just like, well, I guess we'll just block off 40 hours because you delivered a zirconia arch. It's like, well, no, not quite.
Yeah. But I don't know. I would say I was impressed with the way our front office actually responded to it. They were very inquisitive and wanted to solve it, and so it was nice. The one thing that our practice could use some growth on, and I've been trying to gently nudge, is our hygienists are, I guess, that's when I sat down with my 2-hour consult before the PDA conference. It was, your hygiene has the most potential for growth, and I knew that already. I kind of gave up on it a long time ago. I'm fine. I'm busy, I'm doing well, I'm doing the dentistry that I love to do, sort of stuff. But after they're you really could do more here, it was kind of okay, I need to go back to this. And it kind of reinvigorated me to, I guess, take hygiene a little bit more seriously. And I've been talking to my hygienist about doing salivary diagnostics and using the carie-free system and doing, caries risk assessment and taking pictures and, a very complete full exam. And it was, there's a lot of resistance to it. And I've been talking about it probably for 10 years about improving it, and it just never really changed all that much. And then we slowly have been making improvements, and it's great. And it was nice to go to the PDA conference, and they're just basically drove home what I was already trying to talk. So it was it reinforced things I've been talking about for several years. And
that's gotta feel liberating.
Oh my God, yes, it was really
You're
nice.
do you guys hear this?
Yes. When I want to do whole body health, sort of thing, and I want our patients to be active participants in their health, and I want to have a preventive based model. It drives me crazy to think about I don't want to be a tooth mechanic, I don't want to just fix people when they're broken. I want to be there. I've talked to our hygienist. I'm I want to be a cheerleader for somebody's oral health. I want you to be doing backflips down the hallway about getting them excited about, using a water pick and stuff like that. And it's been slow and go, but they're coming along, and it was really, really nice to go to bring them there and to see some really passionate people about, some of those areas. And yeah.
This is fascinating. This is completely fascinating to me, because my assumption for a lot of times is that it's the opposite, that it is the hygienist saying, no, we need to look at the oral systemic connection. We need to bring in the carie-free. We need to do this. And the doctor says, no, like that.
Oh, no, I think you're right. I think that does happen. It's just
okay.
Shawn happens to be this way. Don't you think? I mean, Shawn, you hear that there are hygienists that are like that, but then the dentist drag their feet. That does exist.
Okay.
Yeah.
It's just,
does exist.
You happen to be in the other way around.
Yeah, I would be jumping up and down. If you were my doctor, I'd be like, heck yes, let's do this. So I'm wondering, do you think the resistance, Shawn, was from just that resistance to change, or what were their reasons for kind of not wanting to introduce some of these new elements?
I've pondered long and hard on what it is, and if you can tell me, I would love to hear it. But the thing that my hygienists are amazing people. They are great with relationships, and the strength of our practice is they're the backbone of it. I'm not a super social person, and I'm you like, I have this like, I try to say like, you have to make up for my failings. You guys have to create these relationships. Yeah, I'm not terrible, but like, I just think they're really, really good at it. For the hygienists, like I say, like we need, you guys are our lifeline for the relationships with our practice, and I would say that that's maybe a little bit of that's not my strong suit, and I'm trying to grow in that aspect. So they do a really, really good job, and they bring patients back and they get them to say yes to a lot of the treatment. I think that some of where maybe some of the resistance comes is that we live in a small town. It's I'd say the people that come to us or get to know really well. And I think like offering high level of service and high product sort of like care stuff can come off as a little like pretentious, maybe
Sure.
and I think that if they feel like if they push too much on them, that they're not going to keep coming back to us. And I think that they really, really want people to come back to us, and
That's
which is
what
great.
it is.
Yeah,
They want to keep good relationships at the cost, maybe even of broaching the subject of good health. You want to broach the subject of good health to make the patient healthier, and therein lies maybe the conflict. The interesting thing, though, that to remember from PDA principles is, like, I always am telling my team, listen, if someone says no to what we have to offer about a solution to one of their problems, that's fine. We won't broach the subject again. And I'll even ask the patient, I'll say, are you wanting to hold off on that tooth? It seems like your risk tolerance is a little bit higher on that, that you've in the past, couple years said that you kind of wanted to wait until that was more of an issue for you. Is that okay? Because I don't want to overly bother you. For example, with Invisalign stuff, hey, I still notice, these there's a good amount of crowding, but I don't want to even like discuss it if that's not a concern to you. Are you still kind of wanting to put that on the back burner? It's a nice way of just broaching the subject, but then leaving it there. Because if they say, you know what, I probably actually, I won't ever get this addressed unless it got like super worse or something like that, then it's just like, well, now we know. And that's okay. It's not a bad thing. And so just giving that, where it's like, it's from the book Crucial Conversations, where instead of being adversarial, you against me, it's well, you and I are just looking at this problem and we're assessing how we should manage it and whether it's a concern to you or not. If it's not, then now I know, we'll make a note of that and maybe we'll broach it again in a couple of years. So, giving your hygienist permission to do that. Regan, go.
Well, you just really hit on something important for me. Remember, I'm playing the patient in this whole entire episode, which makes me very happy. There is an important conversation. There's the one, are you willing to wait? Like, we see this, you could do it whole, you could do it partial, you could wait, we can do it in phases, but there's the financial element of it too. And I think that this deserves a lot of attention, because if you just do you want to address this today, or is this not important to you? There needs to be an understanding of what you're financially going to have to deal with down the line, should you choose to wait, should you not be preventative, or should you decide to hold off until it goes to failure point. And that, I have an assumption, will be quite a shock to some people when they get to that end of the line.
For example, I'll say, listen, dentistry is expensive or super expensive. There's rarely ever any time that something in dentistry is cheap, unless you're buying fluoridated toothpaste, which that's debatably even, expensive. But so when we're talking about crowning this tooth, if we end up having to wait and then pull it, we're talking $5,000. If we crown it right now, we're talking $1,500. So one's expensive, one's way more expensive. Now, both are doable if pulling the tooth is what you want to do, and you'd rather do that versus root canal treatment, or you'd rather do that and maybe just see if you can go without the tooth there. Cool with me, but I just want you to know, that we can do it for this price. And I also occasionally will say, I even imagine if this was $2, what you would do. You would get this fixed, but it costs time and money to get this tooth fixed, right? You've got to take time off of work. You've got to be sore from the, numbing and all that stuff. So I get it. But man, if these were $2 a piece, these 5 crowns that we need to take care of, shoot, we wouldn't be wasting time on this conversation. We'd just be doing it. It is expensive. So let's find a way to make this worth your while. And that's at the point where you can also talk, whenever people hear expensive, they go, you should talk investment. It's like, yes, of course. But I just talk real with my patients. I just go, I understand that you're seeing this as an expensive visit, and I acknowledge it. Yes, it is.
You should say investment, and you should say decision. It's their decision. And I like that.
totally
I feel
do.
like you do a great job putting it in their court and saying, this is what I see, and this is the options, but it's your ultimate decision. You own that decision.
Yep. And I think, Shawn, that's when the hygienists just know that it's just like, no, he never puts pressure on. He just is simply asking. And if you demonstrate that, and talk about that maybe on your lunch break, lunch and learn kind of hours and stuff, you're like, listen, if someone says no to Invisalign, if someone says no to veneers, if someone says no to a filling for now, it's just like, that's their call. And I don't mind, but what I'd hate is 5 years from now to find out that the patient said, well, wait, back when you first saw me in 2022, why didn't you bring this up? Oh, I didn't want to hurt your feelings. That's lame, right? That's lame. So we want to bring it up now, so that way you're in charge of choosing.
Yeah. No, that is very good advice. And I guess from, it's interesting. Like, I would say my hygienist, like, tolerance for presenting treatment to patients has grown in the last, couple of years. And, like, we'll talk about quadrant dentistry, and whereas before we'd say like, oh, yeah, it's the crown of the year club, sort of thing. Like, which crown are you going to do this year? But now, like, you talk to people about like, well, we got 2 crowns, and we got a onlay on this tooth, and the patients will come back like, that actually works really well. I got some money in HSA, and
Of course.
like all of a sudden, like, these excuses that I used to make in my head, and I know my hygienist did, like, it's like all of a sudden we're hearing people like, I just want to get that done. And it's kind of eye-opening, and it's good for us, and it's good for the patient, and the patients are affirming that.
So Reagan, I think probably about an hour and a half ago, because this conversation is going great, but it seems like a long time ago, you asked the question, so Shawn, where do you see yourself in 10 years? I don't know where we got sidetracked, but it's not a put down. Where we've gone is amazing, but tell me, like, so in 10 years, what's your 10-year plan?
Well, I I guess this, like, the meaning and purpose of what I'm doing, like, it's like, I want to help people, and I want to bring, like, this is something I came up with, like, just a mission is like, you want to, like, beautiful smiles, create health and just change lives. And I have maxed out on like I'm busy all the time. Like, I don't have any gaps in my schedule, and I got people waiting for treatment. And I would say that now I'm bringing on some people around me to help, and like, we're growing in that sense, which is wonderful. And I think we're helping more people. And like, the one asset we didn't talk about this, my other practice, which is like 15 miles southeast of us, is in Arlington, Minnesota, and that practice is like a medical assistance, like Medicare type of practice, and I intentionally set it up that way. And we have a dental therapist, and then a dentist there, and then 2 hygienists, and it is like a very unique practice. And like, that was another thing that, like, my daughter, like, I wanted to give back to the world after like experiencing that. Like, there's a practice that came available, a dentist, so that couldn't sell his practice, and his son was actually a dentist, and called me up and was like, would you ever reconsider buying my dad's practice, sort of thing. So I ended up with this practice, and I don't know. And I was just like, well, let's give back to the community, sort of thing. And I guess that part of my life, I don't like, I kind of feel open as maybe like my family situation gets secure and we send kids to college and stuff like that, that potentially could grow.
Yeah.
You know, like a, it's not profitable to be in that realm, which brings its challenges. But the clinic does really well, you know? And so like
Is it a feeder program to your other one?
We get some patients. It's not a huge run, no. Like the people that like there's people that drive from, you know, an hour and a half just to go there to get fillings and extractions done and stuff like that. So it's a unique patient population, and I would say that like the people that it feeds from is probably maybe the cash patients that go to that clinic, and because they're seeing a dental therapist, and then the other doctor that there, she does great in the situation she's in, but she likes to take out teeth and do removable, and that's where her wheelhouse is. So like if they get some of the cash patients there, they I would say those are the people that make their way over to do implants and crowns and, you know, different things like that, and root canals. So no, I would say it's not a feeder.
Well, no,
Yeah.
it's just a pure
Yeah.
question. I was just kind of curious.
No, yeah, it's interesting. Yeah, no, but it really, really fulfills a niche in our community. Like I think it's a great thing. Like I have people that are in like, you know, I don't know what, like a person that goes to our church. She's a lawyer. She like is in child custody cases and stuff like that. And she just came up to me and she's like, you know, it's such a great thing that you have this other clinic, because now we have a place to send these children to get dental care, you know. So yeah, so it touches a unique part of, I guess, the people that don't always get care. So
Yeah. All right. So I have one final question, but Regan, do you have any, or should I just?
I have some homework for Shawn.
Let's hear it.
Yeah, I've never done that before. Yeah, you've really moved me. Thank you for the time. I could talk with you a long time, I think. I'm really moved by your passion and your commitment to care. My homework for you is I love the bravery of saying, I see everything that's in your mouth. If you think 5 years and 10 years down, you're already doing great things and you're going to continue to do great things. What do you see in your practice right now that you know is going to have to shift in order for you to make the impact you want? And I think you've already started that. I think you're thinking through that. But if you have journaling time, take that through and calm any self-doubt that you have. I think you're doing what I see doctors doing. You're surrounding yourself with the support you need to be successful, and stay the course, and you will win.
Well, thank you. I appreciate that. Yes.
All right. So here's my question to wrap up. Who's your Yoda?
Who's my Yoda?
Yeah.
That is a good question. Huh. Who's my Yoda? You know, yeah. I would have to, this is interesting. I would have to say it's my wife.
Excellent.
So, yeah, she is a person that can be brutally honest with me, and I don't know how your relationship is with your wife, but I would say I tend towards excess, and I would want to keep striving and growing and all these things, and sometimes I get off on a pathway that that maybe isn't constructive to living a full and complete life. And I would like to think I'm a family man, and that I love my wife and I love my children. And sometimes when you're, you know, like having a blast, you know, practicing dentistry, it's easy to lose sight of things, you know. And yeah, so she every once in a while gives me a nudge and lets me know.
Reminds you to keep the main thing the main thing.
Yes, which is great to have in my life.
Well, that is very sweet of you to say. That yeah. I liked your, like, how you thought about it for a little while too, but that you came up with her. Well done. Well, Regan, tell me this wasn't like a sacred interview. It was very cool. Shawn, thank you for inviting us into your world.
Oh, well, no, thank you. This was very fun for me, and I got really excited about doing the podcast. So I appreciate you guys as well. Thank you.
Good.
Yeah.
This was fantastic. Regan, closing thoughts.
This is going to be one of our best podcasts of 2022, and we're only into April. So thank you, Shawn, for your time. I would love to connect in another year. I'd love to see how you feel in another year and what progress has happened and what you've learned along the way, because that to me, it's the journey, and we're imperfect beings. So I would love to see the lessons you've learned and what you've taken away from it and how you've grown.
Thank you for listening to another episode of Everyday Practices Podcast. Chad and I are here every week thanks to our community of listeners just like you, and we'd love your help. It would mean the world if you can help spread the word by sharing this episode with a fellow dentist and leave us a review on iTunes or Spotify. Do you have an extraordinary story you'd like to share or feedback on how we can make this podcast even more awesome? Drop us an email at podcast@productivedentist.com. And don't forget to check out our other podcasts from Productive Dentist Academy at productivedentist.com/podcasts. See you next week.